When setting up your diet and looking at the foods you want to include, you might ask yourself, should men and women eat or diet differently? This is an interesting question, and while some people might think the answer is a clear no, because men's and women's bodies process nutrients the same, it's actually not that simple. But let's start with the obvious. Yes, the essentials of a healthy diet are pretty much the same for men and women. Both should eat when they're hungry, stop when they're full, and make sure to get the bulk of their nutrients from quality sources like fruits, vegetables, whole grains, and proteins, while also minimizing trans fats and other harmful substances. But besides that, there are a few fundamental differences between the proper diets for men and women, some more obvious than others. First, calories. Since men have generally more overall body mass than women, they need to consume more calories to maintain the body mass. Of course, the larger the difference, the greater the difference in calorie needs. But even if we take a woman and a man of the same height and same weight, there will still be a noticeable difference in calorie needs. Why? Because men have more muscle mass than women. In fact, men tend to have approximately 40% muscle mass, while women tend to be around 30%. And since muscles burn more calories than body fat, you get the difference in calorie needs even for the same body mass. Next are the macronutrients, so protein, fat, and carbs. In general, the macronutrient needs will also be higher for men than for women, simply because optimal intakes are usually calculated as either a percentage of body weight or daily calories. This means men require more total protein, fat, and carbs than women, but the same goes for heavier versus lighter people of the same sex. So this difference isn't due to gender itself, but because of the larger overall weight. Now, what about micronutrients and minerals? Are there any differences between men and women? Two come to mind, iron and calcium. Men actually need less iron than women due to the monthly blood loss during menstruation. The average woman needs around 18 milligrams of iron per day compared to only 8 milligrams for men. This is also why iron deficiencies are more common among women. In regards to calcium, older women are more susceptible than men to weakened bones and osteoporosis because of the hormonal changes that set in when menstruation stops. Therefore, the average postmenopausal woman needs more calcium than men of the same age. Daily calcium intakes at other ages are the same for both genders, however. Lastly, there's selenium. Many people believe that men need more selenium than women, which is false. But there are some studies suggesting that a higher selenium intake can help prevent some cancers more common among men, like prostate or lung cancer. Women do not see a decline in cancer rates with higher selenium intakes, so it might make sense to call this a noticeable nutrition requirement difference between the genders.